Hi, I'm Amanda McNaughton, and I'm the Deputy Director for Alberta's Regional Office of the Trade Commissioner Service. I work primarily with life sciences companies that are planning to enter or expand into the international market. 20 years ago, I was supporting the team that developed the take-home test for colon cancer identification. In 2021, that same test set up a flare that led to doctors finding my husband's symptom-free stage 4 metastatic colon cancer and saved his life. Now I'm looking for a way to save his quality of life. To the problem I'm presenting: mitigating the impacts of chemotherapy-induced peripheral neuropathy on balance. CIPN in cancer patients is a growing problem, as more patients are living with chronic cancer rather than dying from it. It can feel like tingling, burning or warmth, numbness, weakness, discomfort or pain, diminished ability to feel hot and cold, or cramps in the feet. It impacts approximately 40% of patients and can't be prevented. Pain symptoms can be mitigated with medication or cream, but there is no option for managing the impact of numbness or tingling that leaves blank spots in sensation, which is the problem we are proposing be addressed. My husband is a 53-year-old father of 2 who last May was diagnosed with chronic cancer following 20-plus chemo sessions and 2 cancer surgeries. CIPN gradually increased and never fully remediated between first and second diagnoses. In his hands, for a while he couldn't even work a mouse properly, but his brain has retrained enough to allow him to do that again, even for World of Tanks. In his feet, CIPN is experienced as numbness akin to frostbite, occasionally leading to loss of balance. Last Friday, it led to him falling and breaking his elbow. It's getting worse, already impacting his confidence in walking and driving. He continues to work full-time during treatment that will continue for the rest of his life. Without mitigation, eventually he will not be able to work nor walk without assistance. This is increasingly common, and its negative impacts on the ability of patients to participate fully in society, family, work, self-care, etc., even as they live longer, will inevitably increase costs for the healthcare system on many levels: physical, social, economic support to the patient, psychosocial support to a patient and family, caregiver support, independent living, and more. A solution here would impact well beyond chemotherapy patients, as our growing senior population experiences similar neuropathic impacts. Ideally, a solution would involve bypassing the gap between the disabled nerve endings to reconnect where the nerve can still communicate with the brain and allow it to maintain balance with the required instinctual corrections that we don't think about. Alternatively, a rehabilitative device that can retrain his brain to read the diminished sensory inputs that his feet are sending and fill in the gaps, as it were, to compensate, would also be a step forward. Skill sets for this are wide-ranging, and I don't profess to be the expert here, but biomedical engineering, neurological sensing, wearable tech, data analytics, project management, AI, and I'm sure more. We do have support from the oncology team at Foothills Hospital. Knowing he can live with this is a relief, but quality of life will slide rapidly if this continues. Thank you for your consideration.